Hey everyone, it's Matt Tillman here, and welcome to another episode of the Script Note Show. In today's personal finance headlines, I recently came across an article that talks about the costs of an ER visit and the potential for it to even bankrupt some people. We all know this year is an election year, and healthcare is definitely a focus topic for many people on both sides of the aisle, but I think one thing we can all agree upon is how much healthcare costs definitely continue to rise in the country. And with that, I would love to kind of open up this episode to discussion of how healthcare has impacted you or your loved ones in your life. I know for us, with the birth of a little one not too long ago, it seems like we still are continuing to pay for medical bills as it relates to that. So with that, I just wanted to share this article today from the Journal Times, credit to them, about how ER visits can affect your bottom line. So here it is. Medical bills are a huge problem among working Americans and seniors alike. More than 25% of U.S. adults struggle to keep up with their healthcare expenses, according to the Kaiser Family Foundation, and that includes folks who have insurance. The problem is so bad, in fact, that medical debt is the number one source of personal bankruptcy filings in the country. Now, there are several tactics we can all employ to save money on medical bills, like taking care of ourselves and addressing health issues before they worsen into major problems, but sometimes, despite our vigilance, we inevitably wind up in the emergency room for reasons beyond our control. Now, as the article goes on to point out, that's when bills can really start to pile up. Would you believe that in 2016, ER visit spending climbed to $1,917 on average? That figure represents more than a 31% increase from just 4 years prior. It also explains why so many Americans, even insured ones, land in such a deep financial hole when unplanned medical issues arise. Of course, it leads us to question why ERs are so expensive. So, with that, while we can't prevent accidents that might land us in the ER, we can, of course, collectively be smarter about when we go to the emergency room. So, as an example, as the article points out, if you're dealing with a non-life-threatening medical problem like an ankle you aren't quite sure is broken, it almost always pays to go to an urgent care clinic over the ER. With that, you're likely to have a much shorter wait and a much lower copay under your insurance plan. But if you face no choice but to seek out ER care, make sure you pay attention to any bills you receive afterward and aim to negotiate them down. A lot of times, hospitals are certainly more than willing to work with you to make sure that any costs you might incur, don't put a whole lot of financial hardship and strain on yourself. So always make sure that you look into that as an option as well, because a study last year found that hospitals mark up ER services by an average of 340% more than what Medicare allows for. If you find your bills are catastrophic, make sure, again, that you talk to the hospital about working out an arrangement. That's something that not a whole lot of people consider when they get those bills. Or at the very least, you might even manage to get on a no or low interest payment plan, even if you don't manage to get your actual costs reduced. And then lastly, make sure the bills you're looking at do reflect the services you receive. Billing code errors happen all the time. We're all human. And a simple mistake such as that could increase your bill by several $1,000s. So bottom line, if you don't understand what you're being billed for, just call and ask the hospital or medical provider's billing services, because it could end up making an otherwise whopping expense just a bit more manageable to your bottom line. So with that, that concludes today's episode. So hopefully, even just some simple tips, just as far as even just calling your medical care provider if you get a huge hospital bill, it could ultimately make a world of difference. The worst they could say is no, everything is right. It can never hurt to call just to make sure everything is correct, especially, as there's a lot of administrative costs that go into medical bills, so always be sure to watch out for those or any additional fees that get added on. So hopefully you found today's article helpful and today's show helpful to you when it comes to hopefully saving some money on future medical expenses. And as I mentioned earlier, I would love to open up this particular episode to further discussion as to how is healthcare expenses, especially when it comes to the emergency room, affected you and your bottom line. If you're listening to this episode on Anchor, the Anchor app, definitely feel free to leave us a voice message. I'd love to include it in a future show, and perhaps any tips you might have that could help other listeners to the podcast. I'm sure it would be greatly appreciated by them. We're just continuing to look to expand listenership and hopefully help others along the way as we continue to grow. So again, make sure to check us out on Anchor or anywhere you listen to your favorite podcasts, be it on Stitcher. We're also available on Spotify, Google Podcasts, and a host of others, so make sure you check out the link. And if you'd like to contribute to the show discussion, definitely feel free to connect with us on Twitter at my Twitter handle at mtillmann, MTILMANN. Look us up on our Facebook page as well. Feel free to comment on there, or even sign up for our emails on our website at script-notes.com. Again, that's script-notes.com. Thank you again for listening, everyone, and we'll talk to you again real soon. And remember, each of us has a script to play in life, so what notes will you make? See ya.